Hi, William. Morning.
You.
How are you doing?
I'm doing well, doing well.
I just made you co-host, so if you have slides that you would like to share, you can do that. But yeah, let me know if you need anything.
Let me just test out. I have one little thing with sound and just that will play. Can you see my screen?
Yes, I can.
Let me just see if this plays sound. Let's see here. And do you see the presenter view or the actual slide view?
I'm seeing the presenter view.
All right, that's not what we want. Let's do that. How about now?
Now I'm just seeing like the PowerPoint.
Two monitors. And let's see here. This has happened once before.
Your zip
Do you
code.
hear sound?
I do hear sound, yes.
Just one number different, and you might have a whole other life.
So let's just do this. Let's see. It's not showing.
Hello. Hi, William. It's so good to see you. Can you hear me?
Yes, I can hear you.
Oh, good.
Look at that.
We're excited.
Been-
I'm excited to
Been
have
so
you.
long.
I know. It has been like you look good. You're doing good.
Thank you.
How are the kiddos?
They are doing
In college
amazing.
yet?
You know they. It seems like are we there yet? But they are keeping me on my toes. That's
Okay.
for sure. But they're great. They're great. How about Max?
He's doing really well. He's doing well. He's got to give a speech as John F. Kennedy in a couple weeks. And his most important part so far seems to be about trying to get the accent right. So we're going to get a lot of great tape for later in adulthood when I get to show that.
Right.
You know, so yeah, we've been doing good.
Got it. That is awesome. That is awesome.
So William, I'm gonna introduce you briefly, but I'm hoping that you in the process of your talk, you'll hopefully just tell a little bit more about your background and sort of how, you know what I'm trying to say, like just kind of like give, so that would be.
I can do that.
Yeah.
Yeah, I can do that. Your hair is longer.
I know, I'm getting
Look
it.
at that.
I know it's growing. But I keep having to dye the gray out. So there's a lot of that. You're catching me at a good time. So
Gotcha.
yeah, my hairstylist, I keep her busy. So she's like, is it every 6 weeks? I'm like, let's go 5.
Yeah.
You know, like, that's just,
Yeah.
it used to be.
Yeah.
It used to be, but now I think it's just time. So
Yeah. It is that time. I'll go like, what is this on my face?
Yeah.
Oh,
No,
that's a gray
great.
hair. That's
Yeah,
not.
that's gray hair.
That's
Exactly.
not Yeah. Oh boy.
Hi, everybody. We're all getting here. It's great to see everybody today. I'm I'm gonna go run and grab a little bit of water while folks are coming in.
While we're waiting for Bree to get back, I just want to let everybody know that we've opened up the applications for the Harburg Award, which is a student award that we give out every year to one master's student and one doctoral student who show promise in the field of the study of the social and psychosocial determinants of health. So if you are interested in submitting a paper, it needs to be no more than 6,000 words, and you need to submit it by March 20th. I sent out links last week via email, but if you would like to find it other places, we have it on our website. We shared it on Twitter, and you can also just email me if you need the link resent. But yeah, we're excited for that, and we hope you'll apply.
Thank you for that, Abby. So it's 12:03, it's Wednesday, so that means it's time for seminar. So first of all, I'm really excited to see everybody here. I'm I'm in the office today. If you happen to be here, want to go for a walk after William's talk, just hit me up. That's my plan after this. It is my absolute pleasure to introduce you to William Thornton. William and I have known each other. It's been a long time. So, but time goes by quickly when you're having fun. So William is currently the wellness director at the YMCA of Greater Richmond. He'll tell you a little bit more about his multiple hats that I know that he wears. Yeah. William and I'll tell you briefly the story of how William and I met. So as many of you know, I used to live in Richmond, Virginia. I was a member of the YMCA and I walked into my local YMCA in Tuckahoe one day, and there was a sign that said, "Do you have diabetes? We have programs that can help." And they had a flyer, and I took the flyer and I called the number and I said, "I don't have diabetes, but I want to talk to whoever runs this program because I'm very interested in understanding what you're doing and how you're thinking about this challenge." And that's literally how we met, and we started having conversations. We've written several grants together. We organized a community advisory board that helped us with this work. We published several papers together now. And so it is just, it's wonderful. And I know that William is now, when we met, was not in this, he's still in a leadership role, but now he's in like the boss's boss, much even higher up leadership role. And so I'm really excited to hear sort of how the YMCA as a, and William, I think when you sort of talk about it to kind of help us understand, like, how should we think about the YMCA? Is it like a franchise? And so, like in that kind of model, or, but the notion of this organization that has this national footprint that has so many ties to communities, and like what are some of the ways that they're thinking about addressing issues around social inequities in health? So please, again, join me in welcoming William. We're so excited. Thank you so much for being here.
Thank you so much. I'm excited to be here. Always love to see you, Bree, and look for opportunities wherever we can work together. It's always great. And it's crazy to think it's been, more than 10 years, at this point. And so just excited to be here. I do have a couple slides that I'll share with you and then kind of introduce and move forward. Always love to see if all this wonderful stuff works. So I'm gonna share my screen. Let's see here. And let's see what we get. All right. And you probably see the presenter view right now.
Yep.
And then watch this. How about now?
Look at that. Look at bro. All right. Perfect.
I should just end it right there.
It's only downhill
That
from
part
here.
down,
No, no,
one
no.
down. Well, I'm excited to be here. My name is William Thornton, as Bree said, and I work for the YMCA of Greater Richmond. And I get the pleasure to serve as our executive director for our John Rolfe YMCA location. So running day-to-day operations there. And then also the dual hat is serving as our vice president of community health. And I've been with the Y about 16 years now. And just enjoyed the work. Never thought I would get to blend kind of my two loves with public health as well as fitness together and be able to do this work. So in another lifetime, it almost seems like I appreciate these Zooms because I used to work and live in Indiana, believe it or not. And at that time, I worked for the Indiana State Health Department as the prostate cancer coordinator. And my connection there was I worked for the American Cancer Society, but housed there. So I got the pleasure to drive up to Lansing once a month for staff meetings and be able to enjoy the beautiful weather that can be there. And so I appreciate this opportunity to be on Zoom at this point in time. But yeah, being able to combine these passions, the YMCA has evolved and we continue to be what the community's needs are at the times. And we've definitely dove deep into the world of public health and health equity. And I wanted to share with you today some of our approaches and why we got into this work. How did we get there? The city of Richmond is known for lots of things. Craft beer is one of them, but it also has a history of a lot of systemic issues that kind of leads us to a lot of these health disparities that we need. And why I wanted to see, well, how can we address some of those things? So I'm gonna share a brief video that kind of captures a lot of that work and why we got started and what I'm gonna share with you today.
Your zip code. Just one number different and you might have a whole other life. Different school, different job, different dreams, different problems. In America, the zip code you're born in can determine your future. The Y works to change that, with programs and services that help everyone thrive, no matter who you are or where you're from. For a better us, donate to your local Y today.
So this issue of zip code and how your zip code really dictates or can dictate your health outcomes is really what got the Y into the work that we're doing today. And we didn't want a person's zip code to really dictate their health and say, well, what can the Y do in order to help look at and address this issue? We also looked at some zip code analysis. So the Robert Wood Johnson Foundation commissioned some zip code analysis across major cities across the country. Richmond was one of them. And one of the things we found, or they found, was that babies born just 5 miles downtown of Richmond City have up to a 20-year life expectancy difference. And we felt like this is not something that we wanted to be the case. We love for folks to be on our treadmills, swim in our pools, go out and play soccer, but there are a number of folks that just need a little bit extra support. And as we looked at, well, what are those supports? We started to look at these social determinants of health. And as you know, clinical care only accounts for about 20% of a person's health. Is these issues related to health behaviors, socio and economic factors, and then their physical and built environment are all of these issues that really play a role in a person's health. And so we wanted to address health equity because, as you know, some folks just need a little bit extra support in order to move forward, or as we like to say, to get to that starting line. And we want to help and support people to do that. And so in order to do that, we developed a collaborative called Help1RVA. Help1RVA is a collaborative resource to improve the well-being of citizens and make connections to social needs resources such as housing, food, transportation, medical services, and goods. We have social needs navigators. We also have bilingual navigators that work one-on-one with individuals in order to connect them to those resources so that people can get to that starting line, so that they can get the support that they need to address these different health disparities that are out there in order for folks to become their healthiest self. In the collaborative, we have a steering committee that's a cross-section of thought leaders in our region. We have all leadership from each one of the major hospitals in our region, all the different municipalities in our regions, the health departments, and then community-based organizations, all with a mission to move people from crisis to thrive. And I'll show you our framework of how we look to do that in just a moment. And as I go along, we can definitely make things interactive. Please pause me, and if you have questions or comments, please do so. Don't have to wait till the end. But we wanted to use this as a way to move forward, and we knew in order to move forward, we needed to create a brand that wasn't just a Y, so that people could truly come together and work collaboratively. And that's why when you see this, you don't see the YMCA anywhere, even though we are the backbone organization behind the effort. Is all in efforts to bring people together for one cause and purpose. And so the three things that we want to do is, one, create this process so that citizens can obtain social needs resources. And there are two sides to what we do. We have a public facing side where we've constructed this environment where citizens can navigate their own success. Because there are only so many of us, there are only so many case managers. We need to train and work with the community on how can they create their own success. And so we have our website, Help1RVA.org, where people can navigate in their own success, find resources, get connected to community-based organizations. And then on the provider side, we have this coordinated care effort for health systems and community-based organizations, where we can send electronic resources between the community-based organizations so we can have a no wrong door approach. So when we're working with Ms. Jones, she doesn't have to tell her story 20 different times in order to coordinate the care that she needs in order for her to become her healthiest self. We use a platform called Unite Us for the care coordination, and a platform called Find Help, which I'll show you in order for the public facing side. The state of Virginia just invested $10 million in this coordinated care effort on the Unite Us platform. And our steering committee really serves as some of the thought leadership to move that forward here in Central Virginia. And it's just an amazing effort of bringing all these service providers so that we can coordinate care with people within our region. To give you a sense of what we're looking at Help1 from a public standpoint, it is a national database of which that we are a part of. You simply put in a zip code and you're able to look up resources based on different social determinants of health. And so it looks similar to this. If you want to go to the site, you can. All of this is live right now, Help1RVA.org. And it correlates everything based on food, housing, all those social determinants of health. You can change the site into multiple languages so we can meet people where they are. Like I said, we do have bilingual social needs navigators that work with individuals one-on-one, but they can come here, they can navigate their success, they can look up various resources, find the information that they might need in order to move forward. They can create a free login, save information, send it via text or email, and it will translate into the language of their choice. They can also send an electronic resource directly to the service provider in order to begin to get assistance and move forward. We know some people need just a little bit extra support, so they can click on Get Help, and we have a screening tool where we use that's steeped in the Health Leads screening toolkit, where we can screen people positive for things like housing, food, transportation, and then that navigator will work to navigate and connect them to resources. We use the brokerage form of case management and connecting people to resources, and typically work on the top 2 needs that the individual decides they want to work on, and we connect with them. Those connections could range from simply providing them with the resource to doing a 3-way call with them and the service provider in order to help. To sometimes our folks may need additional documentation or in order to even be eligible for programs. And so we're working with them kind of along that journey, all to the point of success, and trying to make sure that they get the help that they need. The framework that we really use in moving forward is this integrated community navigation framework, where we're working with folks and providers within the community to create multiple access points for people to enter the system. So obviously you can go to our website, which is help1rva.org, and you can navigate your success. You can fill out an intake form. We also are out in the community where we're doing community engagement and working directly with people and working to do intakes on the spot. So we're at food pantries, the churches, various events. We're starting to do a lot of work right now with the various shelters within the community and working with the homeless population and doing intakes there and being able to connect people who are on a wide spectrum of homelessness and assist them where needed. So you have all of these different access points. We also have kiosks. And so we have kiosks in all our YMCA locations. And now we're starting to put kiosks in community organizations where a person could go directly to the Help1RVA website. They can make a referral, or they can navigate their own success. Our city right now, Richmond City, is starting to also develop a center that's centered around this navigation, where a person can go into the center any time of the day and obtain the help that they need. Is directly in our city hall that's being worked on and developed right now, and we're part of that effort in and of itself, where there'll be navigators that are on site, and also kiosks and also phones where people can get connected to navigators in order to get assistance and resources that they need really 24 hours throughout the day. Once they express those needs in step 2, then we move to support, and we figure out, well, what supports do they need in terms of, do they need us to work directly with them? Do they need a full case manager that's outside the scope of what we do? And then we do our intake process with them to screen positive, and then we begin referring them to various partners within the community to connect them to resources. And step 6 is really where we get to client learning, and where we're really looking to move people from crisis to thriving. So when people present initially, a lot of times they're in crisis. I need food today. I don't have a place to sleep tonight. And we're working with them to problem solve and get those needs completed. But what we love to do is move towards that thriving, where we're working on resiliency, family support, workforce development, and connecting to those resources so they don't really need the services that we provide any longer, because they've moved towards this thriving effort. And I think that presents some interesting things in terms of research, where we're constantly looking for a partner to work with us in this model to see how do we move people along this. And we use something called the self-sufficiency scale for these different social determinants of health. And how do we move people along? How many touches does it take to move people along? What are the key pieces that are needed for a person to become self-sufficient in terms of childcare or housing? So that we can create models that can then be replicated in other places. In terms of case management, we use the AIMS care coordination model in order to connect people and move them forward. And in that model, we start with patient engagement. We do assessment and care planning development. A lot of our work is done telephonically, where we're doing our case management to move towards goal attainment and then ongoing care. And so that's really our framework and how we work with people and connect with people. And I'm gonna share with you a little bit of the data. I always love data, but I'm gonna pause there and see if there are any questions. I can't see any faces, so this is always an interesting thing because I can only see my screen right now. But any questions or thoughts before we look at a little bit of data?
William, could you, oh, sorry. Or is it echoing on your end or just me?
No, I'm good on my end.
Okay. Could you speak a little bit about how you got to this point a little bit? So in terms of, because I know this wasn't the first time the YMCA has, I mean, in the 10 years we've been working together, we've talked about what is community health, like what is community wellness, like how do we, so I mean, can you talk a little bit about how this logic model fits within the broader thinking of the organization over the last few years?
Sure. So I'll thank you. I'll take a step back. It really did stem from the zip code analysis. Initially, our CEO came across this and said, we got to do something about this. We got to do some things differently in order to get people to the starting line. And so initially, a grant came about from YUSA. And we were fortunate to be one of 10 cohorts across the country to say, if YMCAs were to do some of this type of work, what would it look like? How could it fit within what we do on a day-to-day of your typical gym to swim type of model? And so that work allowed us to explore various database systems that were out there in order to collect information, to do case management, develop what would our intake process be? Would it be directly through membership? Would it have to be completely separate from something else? So we're able to really use that time and energy in order to develop what that would look like. And then we're part of this learning cohort where we had otherwise across the country, there were 9 others that were also seeing, well, what would it look like? Because we could see the need within the communities that we were serving, and there was a pocket that we were missing. And so that is what initially allowed us to develop a lot of the framework of what you see today. We ended up having a wonderful partner in Richmond City, and then the Richmond Memorial Health Foundation from additional funding. That allowed us to actually do a pilot directly in the Office of Multicultural Affairs, where we actually had a navigator and we're able to test out our screening tools, test out our actual site and how robust it was in connecting to resources. And from there, we're able to fine tune things. And then at that point, this little thing called COVID occurred. And because we had this framework and we had all of this work here, it truly skyrocketed us to the forefront in order to be able to provide some of the services that people needed. And we were able to be on kind of this platform with 4 of the municipalities. We had human services cabinets where there were needs, and we served as kind of the expert to connecting the community resources. And that allowed us for this footprint to kind of see what you see today as we move forward.
Yeah.
Other questions? So to give you a sense of volume and what we do, so Help1RVA, we have just about 7,000, just over 7,000 independent users. So folks that are coming to the site that we're working with, which results to almost 20,000 searches for these different social determinant of health needs that they do have. In the Commonwealth of Virginia, you can see just over 60,000, 300,000 searches, and we're able to connect to about 1,800 individual resources and services. And this was all in 2021. in and of itself. And we work really to connect with a lot of programs and constantly building out additional programs within the work that we do in order to move things forward. The one thing that I would say is where, it's similar to the work that we did in our diabetes work and working with a research partner is we've been able to build out something, steep it in research, but we would love to have a partner where we can truly test these things out in order to move things forward. So definitely excited to hear any thoughts or ideas that you all have based on kind of this information that we're presenting today, because we love to create things that can be replicated and then scaled into other places and communities. We also have, in another time, lots of data related to what are the top searches that we have, which is right now is typically around housing, and housing meaning rent assistance and utilities. The other issue that we see primarily is food insecurity, then connecting people to food pantries, helping them get on more benefits so that they can address their food insecurity issues and needs. I did take a look at what you all have in Richmond, because Find Help is a national service. And so there is a network of resources and partners there directly in Richmond that looks to be moving forward. And so if you are interested, I can certainly connect you if you're not already connected to the good people in the state of Michigan, in order to see if this is something you're interested in and moving forward and kind of working with as we move forward. But over a million searches, over 200,000 users. And when we say users, that is tracked by unique IP addresses that directly come to the site and work individually. So we're able to track that in and of itself. The last piece that I will.
William, sorry, can I ask one clarifying question? Is this Find? So Find Help is not the why. That this is sort of Find Help is a platform that the Y contracts with as part of this effort. Is that right? Am I understanding that right?
Yeah, so it is a software program that the Y does contract with. What we do is that software system is only as good as the number of resources that get added to that system within your locality. So we do a fair amount of community engagement in order to connect with different organizations to add into the system so that we have a network of service providers. So for example, we added a little over almost 3,000 additional service providers into the program last year in order to have the resources that are needed to coordinate the care. But we put it into this platform.
So the Y is working with identifying, is sort of bridging the gap between what are people looking for,
yeah,
and then what are the providers that could be potentially meeting those needs and making sure that those people are actually able to like understand if they get registered in the system, this is what that means, is what they're saying. Yeah.
Yes, exactly. And then the other key piece is working with those service providers to use the system for coordinated care. So hospital systems has various EMRs that they're using. There are various things related to food and Feed America where they have certain databases that they are using. And the role that we are playing is trying to bring everyone together for this no wrong door approach so that we can actually coordinate care. So if I do a referral, I can see exactly what happened with Mrs. Jones when I referred her to this food pantry so that she gets the service that she needs. Because what we often find is we give people the information, but they don't actually get the service that they need, or they come back to you and say, oh, well, they said that they couldn't help. but the person, when the reality hits, maybe they didn't go with the documentation that they needed. They didn't answer the question, ask the question correctly, and then people end up not getting services. But we are able to see within our system to coordinate that care, exactly what's happening, and then we can be the in-between with the service provider and the individual to make sure that they do get the assistance that they need.
That's really helpful. Thank you.
Yeah. And so where from a couple items I'll just share with you in closing from a research standpoint is this system and how it plays out, and a couple things that have come up recently in projects were one on the, I think it would be your left side of the screen, Enough to Eat, where they were really looking at the current state of food insecurity in LA County, and one described access to food outlets and food assistance, particularly during the pandemic, and looking at variability and vulnerability in food access. And systems like this is what allowed for to categorize all the resources that are out there, and also get a sense of what the utilization rates were and the localities of those resources, to see, well, what are the gaps that are needed to be filled in order to really provide services to address the issue. In this case, was food insecurity. And so that's one way that folks are also using these systems. On the other side, there was a project related to immigration service providers, and really looking at what's the availability of immigration service providers, particularly in low income areas. And that was a project to see how can we look at various funders and policymakers to make sure that people have the resources that they need, particularly in these low income areas. And so these are some of the things. I didn't work on these particular projects, but these are some of the things that we are also looking at locally here in Richmond. We've done some work directly with an organization called Feed More here in our area, and looking at, well, where are these pockets where people are accessing a number of the food pantries and addressing some of these food insecurity issues. And we've been able to share some of our data related to that in order to really move efforts forward to address these issues of health equity. So I'm gonna pause there and see if there are questions or thoughts, or if anyone is currently aware of work in this area, in your area.
William, this is really exciting.
Thanks, Sharon. Yeah.
Yeah, so one of the things that I just have a question about is you said you had this $10 million, and I'm just thinking about, disseminating and scaling, and, when we look at other cities and how they can do this type of work, you have this one, your CEOs got a hold of this information and said, yes, we see this as an issue, we want to move forward. So you have that buy-in from the top. And then you also had that pretty large $10 million investment, it sounded like, from, yes, was it Virginia or the city?
Yeah, from the state.
From the state. So I was wondering what drove that investment. It's a lot of money on one hand, but at the same time, I think for other states that are on board and see the importance of this, it seems like a very doable amount. So I'm wondering what drove that investment.
Sure. So from the state standpoint, I believe it was probably at least 3 years prior to the investment, they were looking into this issue of care coordination. And a lot of the impetus is surrounding the hospital system and healthcare. There's a movement in healthcare right now where reimbursement is going to be tied to their ability to connect people to these social issues. Is coming down the pipe. And so one of the impetus was to see how do they figure out the connection with these community-based organizations in order to prepare and be ready for these things that are coming here in the future. The advent of COVID is what really skyrocketed because the needs in the community were not new, but COVID gave it the platform that it needed in order to push things forward. And so the timing was right in order to do that. And so there's a human imperative as well as a business imperative that's really kind of the catalyst to move that forward for such an investment. I know that our current CEO just did a testifying hearing to talk about the work that we are doing and moving forward so that further investigation, further dollars can be placed into the state operating budget in order to continue, this work and move it forward, because it's not easy work, it's not fast work. It's all about bringing people together. And as I like to say, play nice in the sandbox in order to truly get the result of care coordination that we would like. Great question. Is there any efforts or thoughts, parallels to some of the work that y'all are seeing in Michigan related to any of these things?
I don't know if Jana can speak to some of the work that the centers, or Nancy Fleischer and that group has been doing on related to COVID specifically. Jana, does any of what William sort of resonate with the work that you guys are doing? Maybe she's not, might be eating. Well, I mean, I think that what's amazing, is when I really think about how, you start, 10 years ago, it was the diabetes self-management program, and very kind of program, kind of almost like the NIH model of like disease focus.
Mm-hmm.
This is our program for diabetes. This is our program for older adults. This is our after school program, right? And now to have, I'm not saying that obviously the youth stuff is still a different part of it, but to have this type of approach is just phenomenal, for a place, so I also just want to, I just think it's amazing what you all are doing. Can you talk a little bit about how does this fit within the national, the YUSA sort of relationship? Where does this, I know that your original coordination grants, you were one of, I can't remember, 10 or 12 sites that were initially sort of seeded, and that sort of has been one of the things that got you here. But can you talk a little bit about how the Y as a national organization is thinking about this?
So I think nationally, we are steeped in looking at how do we address these health equity issues. And so this is something that's important to the work that we're doing, as well as social justice work, diversity, equity, inclusion work. From a programmatic standpoint, the way that a lot of these types of things are manifesting itself is in the realm of welcome centers. That I think we're up to 6 welcome centers throughout the country that's really focused on new immigrants that are coming to the U.S. and getting them connected to what's needed in order to thrive. So not only new people, but currently folks that are here. And I was talking to a person the other day. They said, well, you're still new until you're at least 8 to 10 years in. And so just to give you some perspective of, a person who comes over and doesn't speak the language at all, it doesn't have anything. And so that's one way that it has manifested itself into these new welcome centers, new American welcome centers that have popped up. And in those centers, they have a lot of these folks with this similar role in terms of this social needs navigator and connecting people to the resources and the things that they need. As a movement, A lot of the folks within the cohort, it didn't quite take off as much as we would have liked. But the New American Welcome Center is a concept that is moving forward, and we do have one that is set to launch towards second quarter of this year. That's focused directly on immigrants and refugees. And so the work, this is one piece of the work, obviously, that we do with the social needs navigation, but we also have a portfolio of health activities and education where we have diabetes prevention, diabetes management, Parkinson's programs, specifically around MS, and folks on the spectrum of autism is another area that we work with. Aging well is another key area that we work with, where we're working with folks in order to age in place properly. And not only in YMCAs, but prior to COVID, we were in 23 locations throughout our community doing direct services in the community. And then a new area all within this umbrella that we have is diverse abilities. So working with folks that have a wide spectrum of diverse abilities. And we really look at this social needs navigation as a wraparound service to get people into where they need to go, whether it's a Y program or it's not a Y program, because nobody has to be a Y member in order to participate. And so we go out, and that's part of my fun new role, going out and raising money and getting new grant opportunities to fund these projects that we have. But Bree, the key thing that we would love to do is look at how do we use our network of YMCAs across the country. We'll start in Virginia to scale the work that we are doing to these other pockets that have the needs. We've kind of laid this groundwork and foundation, and then how can we do that? Because we have Ys all over, and then we're using national kind of software systems. So you have kind of this strong infrastructure. We just need to build it out so that it can be a little bit more turnkey for folks to be able to do this type of work.
Deanna, are you able to comment on now?
Can you hear me now?
Yeah, we can. Go ahead.
Oh, good. Okay, sorry, I'm in the car. I don't know what happened. William, this is such awesome work. I'm so excited to hear about it. You guys are really going above and beyond what we're doing for our COVID surveillance, but we are asking about social needs, and we have a community advisory committee. We have not moved on to the stage of addressing them, but it reminds me a bit of my previous work in Chicago, and I know there's some hospitals that are starting to implement kind of a social needs screener in emergency rooms. I might have missed this, but are you guys partnering at all with hospitals on that piece?
Oh, absolutely. So they, in our footprint, we have folks from 3 of the major hospital systems that sit on our steering committee, give thought leadership to move these efforts forward and become part of the network itself.
Terry, did you want to follow up as well?
Yeah, that's great. That was one of my questions. I'm a nurse and I still work in the hospitals. And when we are discharging people and when we intake people, we do some variation of screening, but it is very much, do you have a ride from the hospital to your home? Right. Or are you going to have trouble getting these medications? Or are you homeless and do you need to go to a shelter? So it is very much in that crisis mode. Yes. Which is important to address. So I'm really interested in activities that are related to thriving. And it kind of makes me think of the literature around social determinants of health and health equity, that, there are the immediate reasons that, kind of dictate the state that people are in. And then there are the reasons and the causes behind the causes that are sometimes much more difficult to address, but that can help get communities from crisis to thriving. So I would love to hear anything more you can say on those types of activities that you're doing, as well as does that roll into the outcomes and the impact that you're looking for? And I'll say my research right now, I'm looking at community benefits funding and community benefits investing from nonprofit hospitals in the communities. So how are these hospitals, supporting these communities where they're getting tax breaks, and trying to think about community building activities and how they can really be impactful. So again, that's another reason why your work is really, really interesting. So yeah, any information on those thriving activities and outcomes?
Yeah. So we haven't gotten into that in the way that we want. We've built it into the model because we want to get to thriving and resiliency. A couple of things with some of our partners that they are exploring, that we do referrals with, is we have a couple folks that they're doing some work with DSS to see if I give a person an extra $500 a month, what impact would that have on their ability to thrive? And so that's a project. I'm not part of that project, but that's one of our referring partners are looking at, where they're giving these folks, you have to enroll into the program. You have to have a case manager in order to be involved. But they're looking at things like that. If I get an extra $500 a month, what difference does that make? We have a couple partners that, in the area of homelessness, where sometimes a person just needs, I can't make the deposit, or I can't, I don't have furniture. And so they created these funds that allow the person, I forget what the name of it is, and I just had the meeting the other day, where they can provide these things and say, you know what, I got you. We can provide this for you so that you can make this transition versus moving to another shelter. And so there are things like that from a financial standpoint that folks are looking at to see, well, what is the piece that a person needs? Is it only financial? Is it services that they need? Is it the hand holding and help them kind of move forward? Because we see a lot of these folks, it'll break your heart. We did a point in time survey at a homeless shelter to look at, what are the issues that folks are kind of having at that point in time, so that we can better connect them to services moving forward. And a number of the folks said, you know what, I have a degree, I could have a job, but I just can't keep it together. It's like, every time I get forward, I end up messing it up. And these are even the folks who there is no kind of addiction issue or mental health issue. It's just they need that support and to move forward. So the interesting thing is to look at kind of that parallel between the supports and then the finances in order to help people move forward to kind of get out of the cycle. But those are the two things that some of our partners are doing, and kind of issues that we are looking at. Do we raise some funds that just help some folks to say, we can help and support you in this way? Because we didn't have it, but we had a story of a person did everything they could do, get a job, get a place to live. It came down to the fact that they didn't have enough money for steel-toe boots in order to start the job. If they didn't get the steel-toe boots, then they was going to lose the job. And this was the first day, and so it's little things that are like that we take for granted, that could be the whole difference. That might be the thing that stops that person from trying again. Or that could be the thing, we go and get the boots for them, and then they go to the job, and then they begin to move forward. So that's an interesting piece to kind of look at. What are those little pieces that those interactions that can create success or create non-success?
I think what's so incredible about this is like to move from, I mean, there's both this like giant, you started with this like macro, like zip code, sort of thing, but like then it comes down to these like very, turning point things that are so, I mean, that are you can't, it's like, is that a good investment? Is that a good investment in society to buy this person their boots? Yes, that is a great, that is a 100%, million% return on investment. So, but to have this level of data, and I know that we've talked about this, I mean, just over the years, right? In terms of like, you've got information, but you've got to sort of looking for partners to really unpack that information and bring the rigor to it. And so I really want to, I mean, when William and I started talking about, him coming to give a talk here at CSUP, one of the big goals that we had is to really sort of think about how can we work together, like, and where, we have, and this is, this is baked into how we do business. Like, what are your strengths? What are my strengths? What are your needs? What are my needs? And, I really want to encourage everyone, or, if you heard something today, to reach out to William. William, could you put your email in the chat for everybody?
Absolutely.
You're always welcome to reach out to me. Well, if you've walked, you can't see William, but like outside my door, taped to the back of my door are our fact sheets. Like, they're just sitting, so if you walk into my office, you see the YMCA fact sheets that we created together.
Awesome.
So I you're always welcome to come and talk to me. This is a really unique level of data that, this is a group that is got, and I know you didn't, maybe you could just say a couple sentences about, in your role running, are you running the John Rolfe Y? What's the, is that, and that sort of, can you talk just briefly about how you're thinking about, as you run that Y, the idea of that is like an incubator for kind of testing out different ideas?
Yeah, so as we restructured, we got our current CEO said this work for her is going to also be part of the legacy work, and so we restructured, which moved me into a YMCA location. But our idea, we're all about scaling and moving forward, and so the location that I am in is really thought of as an incubator for community health ideas. So we come here, we develop ideas, we test ideas out to see how do we scale. When we say incubate, it's not just about in our particular location here, but within our community. And so how do we work with the different partners within the community to create something, and create in a way that is replicable, is really what we look to do. So for example, for food insecurity, right now we started mobile food pantries. Right now we're up to 3 locations, and where we're doing mobile food pantries once a month, serving 250 people each time. By the end of this year, we'll be in 5 locations, in order to address those needs, and working with our local food banks to make sure that we don't duplicate services, looking at the data where the needs are. If I have another food bank that's within a certain, mile radius, we don't need to put another one that's right there. So really looking at and using our data, and then how do we then wrap around the services related to navigation, so that as people are coming up, we say, well, what other needs do you have? And then we can follow up. And so those are the types of things and ideas that we kind of work on to truly address the needs and do it in partnership, so that we can scale for replication. And that's how we start to look at actual community impact once we start to get up to scale, because the Y can't do it all. I mean, we're not going to have the impact by just us, having one mobile food pantry. But if I have 8 of them, that could make a difference. And I'm pairing in navigators that's then connecting people on SNAP benefits, helping them to get jobs so that they can actually pay for their own food. Then you can start to look at, well, how can I have, impact within the community?
One of the other group that I'm going to connect us with, William, is a group here that's also so Michigan has the ability to reimburse for some activities of community health workers, which is really state by state. But I mean, I feel like, this idea of like no wrong door, and I think we're all you know, as professionals, we've all experienced like the frustration, relatively minor, of like,
Right.
oh, that's the wrong form. That's not this office, that's down the hall, right? Now imagine
Right.
that where it's like, I took 3 buses to get here and now I was supposed to make an appointment and I mean, you know,
Exactly.
so it's, and to really begin to say, no, there is no wrong door. It is your job to help this person. I mean, that is such a mindset shift. And it's so, I mean, I could talk to you about this all day, but I you know, I feel like there's this, I'm so happy to see how large this has grown, because I know that you've probably been having the exact, you said you've probably been saying this exact same thing for 25 years, you know, and to have both the platform and the sort of partnership at this level is just really amazing. So
yeah, I think so. I mean, I think it's great work, and it's great to see how we can move it forward. And I think the foundation that we put together, it just, you know, continues to incubate to be able to do that. And the intentionality that we kind of put behind it. And so definitely all these things that there's a robust amount of data. As Bree knows, I love to collect information. I may not know how I'm gonna use it yet, but I know it'll come. I know it will come. So we have a tremendous amount of information, and again, with the Unitas platform, we'll have a whole dashboard on health equity, because we collect all of the demographic information, age, gender, race, you know, all of those types of things, so that we know if we're saying we're trying to serve the Hispanic Latino community, I can go and look and see, am I actually doing it? You know, where is it that I'm missing it? You know, and what can I overlay that data with to see, okay, this is where I need to have boots on the ground to do, you know, community engagement outreach in order to drive the kind of equity issue that we're trying to drive. Same thing with our immigrants and refugees. All of those are things that we have that data. We know what the needs are that they're expressing, down to, you know, I'm looking for diapers. I mean, we have it down to that specific. If it's goods, it's not just goods. Well, what type of goods are you looking for? It gets very granular in terms of the data that we have, which then allows us, you know, for the folks that know how to use that stuff, can open a lot of doors, you know, from a policy standpoint and a funding standpoint, so that we can prove that this stuff does work. So hopefully in Virginia, our community health workers, you know, can get reimbursed that's out there doing the work.
All right. Well, please join me in thanking William for his excellent presentation. It was so wonderful to hear. This really phenomenal. And again, don't be shy. You can tell William is not as an extrovert, and it is an absolute pleasure. And I really look forward to our continued conversations and figure out how to get back to working together. I mean, we never really stopped, but like get more emphasis on it. You know what I mean?
Yeah, you can't quite get rid of me. So
I'm not trying to. That's not on my agenda.
Yeah. And then the good folks that are some of the counterparts for these platforms, if you are interested, I've already primed them. So if folks were interested, they're definitely interested in talking further and just connecting with people, you know, directly in your community also that's doing the work. And I always love to work on this stuff. So this is what I do.
All right. Thank you so much. All right, everybody.
Have a great day.
Until next time. Bye. Thank you, William.
Bye.